Hi, my name is Kim Madigan, and I am honored that I was asked to share my story with you today. One day on MP1, I was assigned to a patient whom I will call Kate. She was a CMO patient. I went to her room to bring her medicine, reposition, and provide her with mouth care. She appeared comfortable. I received a call from her son and daughter-in-law. I put the phone to Kate's ear so that they could talk to her. Kate made a sudden movement to lift her head off of the bed. I let them know that she may not be talking, but she recognized their voices. It appeared as though she was trying to get up to see her son. After they were done talking with her, I gave them my phone number and told them I was there until 7 and that they could call anytime to speak with Kate. I also let them know that I used to take care of Kate at a nursing home, and it was my honor to take care of her now. Dr. Jolie had went in the room before morning rounds. He stated that her condition appeared to be changing. I immediately went back in the room. Her breathing increased and she no longer seemed comfortable. I asked Deb, the unit supervisor, to come to the room. I had told her I had administered some medication, but the patient still appeared to be in distress. I did not want to leave the patient. She called the palliative doctor, who came to the room and assessed the patient and changed her medication orders. The one thing I will never forget about the palliative doctor is when I told her I believed that since she was moaning, I was not doing a good enough job. She said to me she must have been a singer because she's singing her way into heaven. That was an incredible way to look at it. The pharmacy had sent her new medications, and Deb stayed to gather whatever we needed from the med room. This was a team effort all around, so I need to recognize the MP1 secretary, Gail, who had gone above and beyond. She came to me and said that the family wanted Kate to have last rites. She contacted the priest, but he could not come in. She asked if I was open to going in and administering last rites with the priest on the phone. I said absolutely. Gail then called the kitchen to bring up oil for the priest to bless over the phone. She organized a time for the call to be set up. When I was in the room, she called the priest and sent him to my phone. He wanted to say a prayer, so I held up the phone to Kate's ear. I started to cry. I was trying hard not to, but I was standing there with Kate, witnessing her last rites and being the person who helped her in her last moments. I was sad for her son that he could not be there. When the priest finished his prayer, he blessed the oil. He explained the process to me and asked me to repeat after him. I made the sign of the cross on her forehead and repeated the words. When we were done, the priest blessed me and all the other nurses on the COVID floor and thanked us for helping the patients. After the last rites, I took off my gloves. I was not going to have Kate die holding a plastic hand. I told her stories about when her son used to visit her at the nursing home. Her son had asked me to mention about her husband that it makes her happy. After 2 hours of being in the room with Kate, I checked her pulse and it was strong. Knowing that she was not in imminent risk of passing, I checked on my other patients. She died several hours later when I had left the room to get drops for her increasing secretions. I cried when I went home. I was not there when she passed. I was told that maybe she waited until I was not in the room so I could see her husband come and take her to heaven. I have had other patients in the past. I have never cried. I felt that I gave the patient all I had to ensure a peaceful passing, and I was able to move forward to help the next patient. However, with Kate, I regret leaving the room to get the medicine. She did not have my hand when she left, and that is hard to live with.